Kia ora.
Natasha. How are you?
I'm good, thank you. Thanks for your quick response to the email.
I was quite impressed, actually. It was quite good.
Oh, it's so lovely to help it mean something, make it mean something.
Yeah, I think it will go down well. Kia ora, Nick. Kia ora, Nick. How are you?
Fine, thanks. Kia ora.
Kia ora koutou. Flo.
Get on, please. Yeah. Goodness me. Technical problems. Me tima te iho.
Are you sure?
What are you saying?
Of course I'm sure. Nō reira nei rā te mihi kia koutou. I tēnei wā.
How do I get out of here?
Oh. Tēnā koutou, kua tai mai nei ki te kōrero ngā mea o te COVID. Nō reira, oku rangatira nei rā te mihi kia koutou ānei he karakia hei whakapainga te timatanga o tēnei hui. Nō reira, ānei te karakia. Tau mai ko te mauri o tū, ko te mauri o ho, ko te mauri o rangi, ko te mauri o papa, ko te mauri o i o te ahu tapu e. Tau mai ko te mauri o tū, te wini o tū, te wana o tū, te whakahihi o tū, te whakahaha. Tau mai ko te mauri ki tēnei pēr, ki tēnei tauira, ki tēnei uru tāwhito, ki tēnei wānanga kia u, kia ita, kia mata. Uhi, wero, tau mai te mauri, haumi e, hui e, tāhi e. Kia ora tātou.
O tuatahi na mihi ati ki a koe paura mō tō mihi me tō karakia hoki. Pai ki te kiti a koutou whānau. Just before we make a quick start, I think a quick round of introductions might be useful, just in case somebody that has come into this webinar aren't familiar with everybody. Let's start with you, Natasha.
Kia ora koutou, ko Natasha Hoskins tōku ingoa. I look after the communications for Nelson Marlborough Health.
Kia ora Natasha. Paula.
Keep forgetting about the mute button. Kia ora tātou, ko Paula tōku ingoa, ko au te pauhiringa o Nelson Marlborough Health. Mai e te taha o Wairau. Nō reira, ko mahi au, kei te mahi au I raro I te manaki o te waka hauora, me te kai haututanga o Dita. Nō reira, nei rā te mihi. Kia ora tātou.
Kia ora Paula, and I love your back screen, buddy. It's way cooler than mine.
Yeah, I got a bit tired of the Pacific Island, so decided to have a bit of the old, what do they call that? The Aurealis, what's it called? Nick, you would probably know. I like the stars anyway.
I'm pretty sure I've seen it. Or could have just been the alcohol. Nick.
Ngā mihi atu ki koutou, ko Nick Baker tuku ingoa. I'm Nick Baker, Chief Medical Officer for Nelson Marlborough DHB and paediatrician by background.
Kia ora, Nick. Flo. You're super important to this meeting, Flo, so just come on in if you're there.
She's just in the moment moving the laptop about, Dita, so she won't be able to respond just now.
We're nice and planned and organised, people. Okay, probably what we'll do is just switch it to you, Nick, just to give a general update on where things are at with COVID-19 across our area and across the whole of the motu. And I think as we go, if people want to raise any questions through the chat, feel free to do so, and we'll pick it up after the next presentation.
All right, I'll just share my screen. Hopefully you'll see a slide in a moment. Is that coming through clear?
Awesome.
So the task I was given was COVID update, and I thought, well, actually, this is a bit bigger than COVID, so I've called it winter challenges. So what's happening with COVID at the moment? Looking across the motu, northern region had their peak, long tail, little bit of a blip, and basically pretty flat. Southern region, which is really the South Island, less of a dramatic peak, but very flat, very consistent cases. And if you look at the colours on the right, the redder, the more COVID, and West Coast, which got it last, has still got the most cases, and South Island overall getting more cases per capita than the rest of the country. So no space for complacency around here for COVID at this moment. And further reinforcing that, if you look at hospitalizations, we had that big peak, lots of people in hospital, sort of 800 or so, March, April, but it's not gone away. We've still got that 400 odd people in the system, in hospital with COVID. So it's a big problem ongoing. And what's happening for us? Nelson Marlborough, same pattern, absolutely flat, 200 or so cases a day, 280, give or take, coming through. And then what's it like for our local Māori? So this is the Māori curve across Motu, and again, a higher peak, but still 30 or so cases emerging each day. And actually you can probably double that or triple it, because we only know of the cases where people go as far as to get a rat test and put it into the system. So real numbers will be a lot higher than that. What are the risks from COVID? So this is quite interesting. If you look at who's getting it by age band, it has been a lot of our young people so far. So this is Nelson Marlborough data in blue. So the 10 to 19 age group have had the most cases. So school age kids who then spread it to their parents. And it's only now just beginning to get into that 40 plus age group. But who comes to hospital? Largely it's the older people, the 60 pluses. And then on the right, this is national data, which is who dies by ethnicity from COVID. And these are actually quite scary figures. If you look at overall, for all ethnicities, it's the older age group, but those gray columns are the European and other, and the blue ones are Māori. And just focus on that. So the total number of deaths in the 50 to 59 age group with COVID as the underlying cause is more in Māori than in Pacific or European, and pretty similar for that older age group. So the national decision today to say the booster dose goes down to 50 for Māori and Pacific is really, really wise, given that that group of people are dying from COVID out of proportion to the number of people in the community. So critical people get that fourth booster.
Aroha mai, Nick, I've got a question for you for that screen. Yep. Can we go back to that screen again? So looking at the scale from 70 plus, basically, it's, you know, it's showing that European people were dying mostly. Would Māori life expectancy have anything to do with that, do you think? In general?
Undoubtedly, that we have not got a very large number of Māori people living into the 90 plus age group. So we've got our Māori community is overall very young. So good news here, we're not seeing the deaths in the young age groups, which is brilliant news. But we do see that group, which is really reflecting that we've got a number of people who would really benefit from being vaccinated in the 50 pluses. And fortunately, we can.
Could that be said for most health issues for Māori, the sort of 50 years to 70, 75, 79 is what we should be targeting with most illnesses, isn't it?
Well, an awful lot of illnesses, Māori suffer 10 or 20 years younger with the same level of disease as others. So all our work with cardiovascular disease, respiratory disease, and increasingly we're seeing that targeting, but there's still a way to go. So just as a reminder, when we locked down, we really locked down and it was very quiet. Now it is not quiet, it is not lockdown. So we need to be very ready for this winter. And if you look back over the last few years as to what's happened with our winter surges of respiratory disease in emergency departments, so gorilla grey blobs are winter, and we had a peak in 2019, a sort of normal peak. a very low peak in 2020, a strange short peak in 21, and a big question mark over 22. And the reasons those followed the shapes they did is we had that month of lockdown level 4, sort of as winter was starting, and we never really released people to mix and share viruses in 2020. And we cut winter of 2021 short really quickly with 2 weeks of level 4 lockdown here, and in the North Island even longer. So that just put paid to infections. So a normal winter peak is quite a long rolling hump. And the worry is that we're going to get a long rolling hump this year that will really stress our communities. So this is some of the modeling we've got that we've had pass through our March peak of Omicron, and we face the winter peaks of flu and respiratory syncytial virus coming. So we have to be ready for this multi-virus winter season. So we must plan for a lot more than just COVID. And this is the modeling we're getting at the moment for Nelson Marlborough. So 3 lines out here, a yellow one, which is if we mix a lot, a blue one if we mix a little, and a green one if we hardly do any mixing. And so far, we're much more along the yellow one. So this is total numbers of cases, peaked later than it might have done, and really has not gone away. And we've got to be ready for another blip of just COVID coming. And if you look at hospitalizations, very similar pattern, blip, but hasn't gone away. And that's partly because we may have fewer cases, but it's moving into those older age groups. And so with that yellow line, we may well be expecting a significant increase in COVID cases through July, August, September, as people mix, and particularly the older people mix and move around. And quite an interesting place to follow is this thing called Flu Tracker, which is really showing how much flu is in the community, how much flu-like symptoms. So we're relatively spared. It's just picking up in the North Island, picking up a little bit in Canterbury and Dunedin. We haven't really got any red spots coming through yet, but it's not far away. And we are looking at an increase in flu-like illnesses across the community. And really, I know that the hospitals in Auckland, Hawke's Bay, Dunedin, Christchurch have been extremely full recently. And so what will winter bring when you think not just COVID, but other viruses? So that was the peak we had. As we go through, we're expecting in terms of hospital bed days, a peak almost twice as high as what we did have with just COVID alone. And interestingly, if you look at the bottom one, there's this peak of illness, particularly for Māori, in that green column, which is a lot of that is RSV in small children, which is something really important to be alert to. And we must learn from the winter of 2021. So that's what the detail of our hospital workload in ED was. And an awful lot of this was bronchiolitis, a winter peak in kids under 1. And Māori probably 4 times overrepresented in that group. So bronchiolitis is a nasty respiratory infection. So in a little baby, instead of just having a runny nose and a sore throat, this goes deep into their lungs to cause major breathing problems. And this is worse if babies were smoking before they were born, because that means their lungs are smaller and the whole baby is a lot smaller because of smoke exposure before birth. And if we want to prevent bad bronchiolitis, we've got to try and support smoke-free homes, keep going with our warm, dry homes and try and reduce the overcrowding. And we've got that chance to do all the good stuff that we know can prevent viruses like COVID, but also will prevent the spread of RSV. And so the symptoms are typically starting with an ordinary cold, which gradually builds up over 3 to 5 days with a snuffly baby, begins to slow down with feeding, has a sort of brassy cough, and then they can get short of breath and have difficulty taking feeds at all. And by the time they get pale and floppy, they should have been in hospital about 12 hours earlier. So it can be a really serious illness that takes 7 to 10 days to recover. And I think for the whole community, those red flag signs on the left are really important. That little ones under 4 weeks, particularly important to get help for. Any baby that's having pauses in breathing or stopping breathing, we're really worried about. And similarly, babies can go really pale, and being really pale, don't look out for the baby that's really red. A pale baby's just not getting enough blood to their edges, and they may get bad respiratory distress. And another marker of concern is when a baby can't take 50% of its normal feeds. So just to give you an idea of what this looks like, this is just a short video, if it comes through, of a baby really struggling to breathe who should really be in hospital by the time they get this sick. Drawing in that chest, every breath is really hard. Lips just beginning to go a bit blue, but as I say, blue is really, really bad. Very pale is also quite bad. And you can see that baby's sort of lost their get up and go. They're getting quite lethargic. They're not getting enough oxygen into their brain. So these are all the signs that this baby, as I say, needed help hours before this. So I think if anyone's looking after a baby at home and they start to see these signs, that's a sign to get help. But on the other hand, if your baby's pink and lively and taking their feeds normally, they're probably fine. They may have a runny nose, maybe coughing, but they're not actually sick enough to need much more than just regular feeds in time. So a sad video to see, and sadly we will see quite a large number of kids in our community this year with those symptoms. And actually for little babies, that RSV is worse than COVID. COVID is often a very mild illness in the first year of life, just a little bit of fever. Bronchiolitis is a severe illness. So how are we doing getting our Māori community vaccinated? We did really well early on, but the actual uptake of vaccines out here is now really quite low. So we've got an opportunity to plan for the booster coming to try and make sure we can top up those who haven't had all 3 doses and get people their booster dose. And if you look at the way...
How many boosters do we need to have?
So that the first course is those 2 doses, and then you get the second course, the 3rd dose, which is the booster. So this shows what we've done in terms of vaccinating. So as we went across our whole community to give out 365,000 doses of vaccine, to begin with, it was all the 1st and 2nd doses. Then we had the surge of boosters. And over here to the right, we're hopefully going to get another peak as people get their 2nd booster. So it'll be 4 doses in total to really top up your immune system for those that are, for Māori that are over 50, or people who are medically fragile, as in having an underlying condition. Even if they're under 50, if you've got something that makes it harder to cough and breathe easily, or immune system's not great, you're probably eligible for a booster, extra booster. And that's the space I want to see decorated with lots of vaccine. The red circle, that's what we need to see, is getting the next color coming in there as we're really successful with our 4th booster. So winter, we've got to try and do best to keep everyone healthy and support healthcare, self-care, which is why I went into that detail around bronchiolitis. Make sure our community health services are as strong as they can be, and only those who really need the emergency department come to hospital. And if you do get there, that we've got beds on the wards. And the only way we'll have beds on the wards is if we're managing to get people home. So the way ARC's working and the return to community is really important. So it's not just about hospital, it's about all the things that go before hospital and the things that come after hospital if we're going to get through this winter, through a really busy spell. And so some of this is about some of the things we did for COVID, which aren't adding much value, we should stop. And some things that work really well for COVID, we should keep doing more of. And I think staff sickness is already just beginning to rear its head a lot the last couple of weeks. And we're just going to have to think, how do we have that staffing pool for healthcare workers? But in fact, every industry just needs to work out how they can keep running despite high levels of sickness. So our winter planning is trying to keep people informed, which is why I'm doing this today. And prevention is still really, really good. So vaccines, hand washing, keep people separate if they're unwell. Services, healthcare services, really important. The acute services and the planned services, people need to know where to go. And just as a warning, if you're waiting and getting worse, get help. We don't want people who were on a waiting list to totally trust the system and say, well, look, I was waiting to see someone about my eyes. They're getting worse. I can't see anything anymore, but I trust them. We want to know about people who are getting sicker so that we can reprioritize them and get them the care they need as fast as possible. We're only going to test for COVID, for RSV and flu in the hospital. If you've got symptoms, the best thing to do is to keep away from other people to not infect them. And the second boost, I've already talked about that for Māori, 50 and over and Pacific, and for people who are medically fragile, but a good chance to top up other vaccines when you get in your booster. So key messages really at this stage is we've actually done okay with COVID. Our good vaccine coverage has meant it wasn't the disaster here that you've seen across the globe. We haven't had to have funeral pyres in the streets and large recruitment of undertakers and all of those things that we've seen elsewhere. But this winter's coming, so we just need to be ready for it and update our vaccines now. And the peak's had a long tail, and it's going to keep on that long tail and blip up again. And opening the country up is a chance for viruses to get in, and winter is a chance for viruses to spread more. As it's a bit colder, people are closer together. So a negative rat test, it's useful to do a rat test, but actually if you're still feeling like you've got symptoms or might spread a virus, even if your rat test's negative, keep away from others. And the fewer infections we start the winter with, the better we'll be through the rest of winter. So Kiara, I'll stop at that point and happy to take any questions.
Yeah, just a few. First of all, just to acknowledge you, Nick, on their presentation. As usual, it's very good to have that overview. And the way you do it is excellent. So just thank you for that. The first one is around I guess, the emergence of new health issues alongside COVID. What are those main ones, and how can we protect ourselves in regards to those issues that are arising, like the flu and others?
Yeah, I think there's the sort of three bits to this. There's the COVID, which I think we begin to understand quite well. Flu, coughs, colds, winter, I've talked a lot about, but actually, I think the one that is really, really important and maybe bigger than the other two combined are the health consequences of the stuff we've not done. The routine, good healthcare that people have missed out on, which is sort of blood pressure checks, diabetes checks, supporting weight loss programs, supporting smoking cessation, sort of mental health, all of those things. So I think the message is healthcare is still there. And I've already tried to say that if you're getting worse, get help. People are not too overwhelmed if you're really overwhelmed yourself, the system will provide care for you. So just make sure you persist, find someone to help you get the healthcare you need in that space. But I think we are at risk there, and I think vulnerable people with less access to healthcare will probably suffer more than people who are not so vulnerable to start with. So every reason to get help and talk to other people about it.
I think that's very good advice, Nick. I think while we know COVID's really important, getting many of our whānau vaccinated as possible and following, I guess, the requirements to keep ourselves safe is really important. What's also really important is to ensure that we're focusing on our health in a wider sense. And I suspect you're right. I suspect that the data will in coming months show that the health inequities that Māori have suffered through cardiovascular disease or cancer and all these other things probably has increased during the COVID time, because everyone's been focused on COVID and forgetting that health or holder is much wider than COVID. COVID's really important. Get yourself vaccinated. Do all the things that you're supposed to do in terms of the requirements, but at the same time, don't forget about your holder in a wider sense as well. Otherwise, we're going to see, and we will see, those health inequities grow and get wider. Huge opportunities there, though, to join up some of those approaches around COVID to other health priority areas and bring those into COVID events, to hui, to iwi events, Māori provider, Māori events, those types of things. Huge opportunities there. Can I just ask you, Nick, how are we tracking as a people in terms of our vaccination rates? I heard the other day that we've got over 90% of our Māori population vaccinated. Are we getting to a stage where we can start to feel somewhat safe, or are there pockets there that we still need to address?
But for those who are most vulnerable, the over 65s, you're right, we've got really good coverage. But sadly, we've got, as you get younger, we've got ever decreasing coverage. And so we've got, and if you look, remember those numbers, people in their 50s and 60s, especially Māori, are vulnerable. So people really need to be vaccinated in that middle age range. And also our rangatahi, they're out and about spreading it, sharing it. They need to be vaccinated, and many of them will also need the MMR booster, because we may well get measles coming back. So maybe the two things could happen together if you know you're behind in that age group. And then we've still got relatively poor coverage for our school age kids. Now, they don't get so sick. They don't get to hospital too much, at least not the sort of over fives don't, but they are able to spread it. So again, important for the rest of the whānau to try and keep your kids fully vaccinated. It's just part of their armour to protect them personally against COVID, but to protect the rest of their community against COVID too.
We all know whānau or friends that actually haven't got vaccinated for a whole range of reasons. Is there anything that we can do to encourage them to get vaccinated? What can we do?
I think listen to them. Why have they not got vaccinated, and where are they getting the information from? That everyone has a right to make a choice. I think we have a duty to provide them with good information to make that choice from. And the trouble is that there's an awful lot of bad information out there. And if you think about your vaccine choices as something really precious that you should look after with as much care as you would your money, and just because someone on the internet tells you to send them $10 or $1,000, most people don't do that. And so be as careful with your vaccination choices as you are with your money, and go to people who understand vaccination, not those that make media content because they claim to understand it.
Funny that it reminds me of my sister who didn't want to get her daughter vaccinated. She was really concerned about it, despite the fact that she herself had been vaccinated against COVID. And the way that I convinced her to get her daughter vaccinated was to say that I'd vaccinated my daughter of the same age. And I said, do you know actually what happened when I vaccinated her? She goes, what? I said, absolutely nothing at all, other than she got a little bit more protected against COVID-19. In fact, a lot more. And the very next day, she went and got her daughter vaccinated. So I think there is some power in the relationships that we have with those of our whānau and friends that haven't got vaccinated, by saying that we've done it and we're okay. We're okay. In fact, we're protected a lot more because we've done it. So I think that's something we probably should pick up.
We've now got an incredible amount of information about vaccines and their risks and benefits. It's not like some people worried initially, oh, it's only been out there a month, it's only been out there 2 months, but actually billions of people have had the vaccines, and the benefit of vaccine far exceeds the risk. But there's always going to be a small amount of risk with it. But COVID remains a very nasty disease, as is the long COVID that can follow it.
We've got a bit of a response on chat there from Tāwhina Marae, just saying that we need good information about the risks of vaccinations also. I have staff who have been very unwell after receiving vaccinations and would be reluctant to continue with the new vaccinations. What's your thoughts on that, Nick?
I think people need to get their own personal advice about vaccination. It's a personal decision. That being unwell after vaccination is mostly mild, and mostly it just shows that your immune system is being revved up, ready for the real COVID. And you could talk to a lot of people around our community who would be saying, I've been really sick with COVID. And there will be many more of those than the people who are very sick with vaccine. But if someone needs, if it's a personal decision, they should get personal healthcare advice about whether the vaccine, if they had enough of a reaction to say miss out the next dose, so be it. Some people won't tolerate the vaccine, but the vast majority will do. And actually, any side effects you get are far less severe than the impact of COVID, which attacks your lungs, throat, potentially heart and brain, and leaves you with long COVID if you're unlucky.
Yeah. Okay, well, thank you for that. Just one of the things that I sort of wanted to ask you a question about, Nick, is, you know, a lot of people feel that the vaccination might be unsafe. What's your thoughts on that?
But I think, again, it's that balance of risks. We've got masses of information about safety. You can go to the IMAC website, you can go to the World Health Organization website. There's lots of, or CDC in the United States, that explain the balance of risks and benefits. And so that we know COVID is very unsafe and nasty and takes a long time to recover. The vaccine will cause some local aching, will cause some fever in some, will cause a bit of a sore shoulder in some, but mostly those symptoms have passed quickly. And even those that get more severe disease, you've probably heard about people getting heart complications from the vaccine. That is almost invariably self-limiting and certainly far milder than the heart complications you get from COVID. But every day we make these sort of balance of risk decisions, and that's sadly that's what we have to do.
Your graph showed that, you know, the impact of COVID-19 is declining, you know, the numbers of cases, and then you show a peak a little bit later on, in fact, not far away. So we haven't got on top of COVID. Are we ever going to get on top of COVID? Or is it just something that we're just going to have to live with forever a day? And what's that second peak about?
So the second peak is really the impact of us mixing more and sharing our viruses more within our own motu, but also importing them across our borders, that people are flying in now from all over the world, bringing in slightly different strains of COVID, which may well, some of those will spread faster. We at this stage don't think there's any that are worse in terms of sickness. And then the other thing that favors the winter, or the virus is favored in winter, is that with lower temperatures and higher humidity, the virus in droplets doesn't evaporate and die as quickly. So your range when you cough and sneeze is greater to spread it to others in winter than it is in summer. And we don't have the UV light to kill the virus in winter. And then people gather together in closed, more confined spaces with less open windows in winter to again spread the virus more. So winter is a good time for viruses and a bad time for people. So that's what that peak is about. And then you have to add to that the other viruses that we know have started, that Southern DHB Dunedin's had a big outbreak of flu amongst its students, and it's just getting into the older population. That's a flu A, which is actually covered by the flu vaccine. So the likely strain of flu we get is covered by flu vaccine. So that's another thing to just make sure people are aware of, get their flu vaccine. And we've got RSV just picking up from the northern DHBs. And I know that Countess Manukau has been extremely busy recently. So we have a little bit of a lull, time to plan at the moment, but busyness is coming and sickness is coming for us all.
Just to recap, Nick, can you get flu and COVID at the same time? And is it possible to get a flu vaccination if you've got a COVID vaccination? How much of a time difference does there have to be?
You can get those ones together now, the vaccines, and sadly you can get the diseases together. So you can be sick with flu and then you can get COVID, which would be a really bad mixture.
Wow, okay. So the best way to protect yourself, get immunised.
Get vaccine and get personalised vaccination advice for yourself, that everyone's got some complexity in their health, and it's just important to get your own advice from the person who you get health advice from. And I guess that's another message, is everyone needs that sort of contact with general practice or health provider to help look after them through this winter season.
We're hearing things about new variants of COVID appearing. Do you have any information about that?
Yes, there's a sort of alphabet soup or coming through across the border of different varieties in terms of BA1, BA2, BA4, 8 and B 1.2.4.12. So there's a lot of alphabet soup arriving. So far, some of them may be more infectious, but they don't seem to be worse in terms of making people sicker. And that's often the trend as a new virus gets established, that when it first comes on, it's a little bit of an amateur at infecting people. It doesn't infect them well, and it makes some of them so sick they die really quickly and don't get to spread the virus. As the virus gets established in humans, often it gets more infectious but less severe. And answering the question you asked before, what's COVID going to do? It'll probably just join the other viruses we get each winter, and probably will end up with a combined flu and COVID vaccine in the years to come. And it'll just be part of what we do, and we'll put it behind us.
So if we've got time on our side, hopefully the different variants become less and less dangerous, and there's more and more herd immunity through vaccination, or actually just catching COVID, and we're more protected as a population.
That's what we all hope for. Just as before the pandemic started, there's always a chance that some rogue virus will come again, which could be COVID, in which case it's almost the start of a new pandemic, or it could be something different. It could be a modified monkeypox that roams the globe next.
Yeah, we're in a battle against time, really, to get our people protected against COVID as much as possible. And Paula touched on the fact that, you know, pretty much probably the ones at risk at this moment in time tend to be in the 50s plus. Yeah.
Sorry, I missed the last word there.
The ones that are most at risk possibly of serious impacts from COVID tend to be in the older population, yeah?
Yeah, absolutely. So I think across our whole community, the over 65s would be the most at risk. But for our Māori community, as that graph showed, the over 50s are significantly at risk, which is why they're eligible for that booster. And that reflects the fact that many people begin to get more illnesses at a younger age within our Māori community. And so we've got to do our best to protect them.
Yes, exactly. That's always been the case, that Māori get earlier disease and illness and death 10 years earlier than the rest of the population, generally speaking. So yeah, targeting our whānau that are in their 50s really, really important. And I suppose it's also upon us, because what we know, certainly with our older kaumātua, like our really older kaumātua, the vaccination rates tend to be quite good, but still there's quite high death rates amongst Māori in that area. And I suspect that's probably because of the comorbidities and all the rest of it. So getting protected against COVID-19 is not just about protecting yourself or your tamariki or your mokopuna, but it's actually about protecting your kaumātua as well.
Yeah, everyone gains if we have less COVID circulating in our community. We can have less COVID circulating by having more people vaccinated.
Can't wait. Now, one of the things that you touched on was warm, healthy homes and also smoking. And let's touch base on smoking there, because we know the population that has the largest rates of smoking in the whole of the motu is Māori. So what can you do if you're Māori and you need to give up smoking, given the impact that smoking has on you in terms of a whole range of things, not least of all, lung cancer, or even unexplained death in an infant, SUDI death rates driven by smoking, so many bad things driven by smoking. But I guess if you're a smoker, you're more at risk from things like COVID and other respiratory issues. And even what about vaping, which has really taken off amongst our Māori community as well, which has just been raised. What do you do to get rid of that?
So undoubtedly smoking is really bad in all age groups. As I said on the slides, that the quantum leap of benefit we can gain by stopping smoking during pregnancy far exceeds what we can do in any other age group, because of the dreadful effects on babies being small, vulnerable, subject to sudden infant death, more subject to bronchiolitis. So really support your whānau who are considering becoming pregnant. Is a great time to get smoking cessation support. And with our Puppy First program, we'll actually help people with money if they stop smoking in pregnancy. So some brilliant initiatives there, as we have for now all age groups. there's masses of support out there to stop your smoking. So I think it's setting a date when you're going to stop by. The sooner that date, the better, which is really important. And getting the support needed, but it's never going to be easy. But the road to success is always littered with failures. So just one failure is not a reason to stop trying. It's just a case of let's put things in place. And for me, one of the most useful tips is to ask people what's good about their smoking, and then see how you can replace what's good about their smoking with something else. It's something you do with your mates, something you do to relax, something to keep your hands busy. Just think it through, and what are you going to replace it with? Because you can't just take it away and not have something good coming back. So I think there are ways of doing it, but I'm sure many of those online are far more experts at giving smoking cessation advice than I am.
Well, the tobacco industry is an ugly industry. It's a dark industry and it targets people right across the globe, but it certainly has targeted Indigenous people and it certainly has targeted Māori, and it's an ugly dark industry. So you look at the quit smoking cessation program that we're running, you can access that through the likes of Te Piki Oranga or Public Health. And yes, what they'll give you is nicotine replacement therapy. So that'll help you with your symptoms. And they'll also give you coaching on how to work through giving up tobacco, because that's no easy feat. And then the other thing that they'll do, as Nick said, they'll give you supermarket vouchers, okay, if you go smoke-free each week. And they'll do that for several months. And, you know, that's going to make a huge impact. One, because you're saving money by not spending it on tobacco. And two, you're getting extra food vouchers to help with your pie on the table for your whānau. And plus, it protects you. And if you're a hapu wahine and you're smoking, that smoke's going straight from you right to your pepe, even before that baby's born. And that's one of the major reasons why we have a whole range of respiratory issues for Māori, but also as one of the key factors for sudden unexplained death in an infant. And guess who leads that in the country? It's us as Māori. And yet we're combating that stuff, and we need to. Nick, you know, there is a bit of talk about, you know, I've been vaccinated, I don't need a booster. And actually, ironically, some people have been vaccinated and yet they don't feel that the booster is safe.
Yeah, I don't understand that really, why people are feeling like that. I can understand if people have had a bad reaction to the second dose, they need to make their choices. But actually, the sort of natural history of your immune system is the more practice it has, the stronger it gets. And so you support your immune system practicing with the COVID vaccine before it has to face the real enemy of COVID. So it's like building up to a rugby match, netball, whatever. You actually need to practice in safe, limited exposures, limited activity before you face the real thing. And the booster adds further experience for your immune system to make it stronger to fight off the COVID when it does come. And the second booster adds even more. And the reason we're doing them is there's good evidence to say that the benefits of vaccine are beginning to decline after 6 months. And you can refresh those benefits by the booster, and you refresh those benefits again by the second booster. So, and that's what our immune system has done through all of our evolution. It's got stronger by exposure to things it has to fight. And we mimic that with the vaccine, but we mimic it in a much safer way than exposure to an illness that can maim and kill.
Yeah, those are really, really good points. Actually, Te Awhina Marae has also mentioned the impact of marijuana on our whānau as well, which has, as we know, an impact on a whole range of things. But obviously, if you're smoking marijuana, that possibly could have an impact on you if you get COVID-19 or respiratory issues.
So I think that the message really has to be that lungs are designed to breathe clean air. And everything you can do to make the air going into your lungs cleaner is good. So if you're a heavy smoker and you take up vaping, you're probably going to be safer than when you're a heavy smoker. The harm you do is about 5% of the harm done from smoking. Marijuana also is a foreign substance that gets into your lungs and causes impact on your lungs, but also has an impact on brain function and other things, but especially for young people in terms of them getting on with motivation and the likes. And then for young people, we do have a worry that some of them who've never smoked may take up vaping. And for them, the vaping is only doing harm. So you're introducing a foreign substance into their body, which the lungs weren't designed to manage. And you're potentially introducing nicotine, which is illegal under 18, but that doesn't mean people won't do it. And another little plug, actually, while we're on the subject of vaping, is just the vape fluid is very poisonous if it's got nicotine in it. So treat it like a medicine out of reach of kids, because children have died through drinking vape fluid, and that gives you a marker of just how toxic it is, that a small dose of vape fluid can kill a small child quite easily.
Kia ora, kia ora. Thank you for that, Nick. Natasha, I wondered if we could just turn to you, and are there any sort of things that you'd like to relay just from a communications point of view, where our whānau can access good information around COVID-19 and what supports they can do and what requirements they need to meet and all that sort of thing to keep themselves and their whānau safe? Just hand it over to you, eh?
Kia ora, Dita. I've actually been sitting here listening to the presentation, thinking back to where I was when I first heard about the very first lockdown. And I remember I was at home with my then 3-year-old son, watching the TV by myself, and there was Jacinda telling us that the country was going into level 4 lockdown. And I just remember bursting into tears because my family are in Australia, and my mum is one of 10 children from rural Australia. And being the second youngest, I thought that I may never see my aunties and uncles again. And felt very privileged a few months back to be able to go over to my mum's 70th birthday and see my whānau again. Vaccination is just amazing, isn't it, in what it's enabled us to do and achieve in a COVID space. But looking forward to winter, it's not just COVID that's going to be on our doorstep. As we open up to the world, we have MMR, we've got flu. We know RSV was hard for our young last winter. So from a marketing or communications perspective, we find ourselves in this world where it can feel like everything is coming at you at once. And really, the strongest thing that will help us and keep us through this winter is our whānau. And so I'm very proud to be able to support Kotahi in promoting their events to you today. So the 3 Hiwa days, Hauora days that we have coming up through Matariki, we've got one in Motueka on Sunday the 19th of June at Motueka High School. We've got one in Wairo at Seymour Square on Thursday the 23rd of June. And one at Tahuna Playing Fields on Saturday, the 25th of June. And these are about supporting Matariki and about being with our whānau and about not being afraid and about collectively looking after our own health and well-being. So for me, from a comms perspective, it's not about a vaccination. It's not about a website. It's about coming together as a community now and how we're going to work together through the next winter that is on our doorstep. So that's where I'm at this point, Dita.
Ka pai. It's a very good whakaaro to hold on to. Actually need to work collaboratively together to get over or through this. And understanding that it's not going to disappear, it's going to be an ongoing thing forever, I suspect. And I think the other thing too is the loneliness and the disconnection that COVID has caused for many of our whānau is something to be really, really mindful of. And even though I guess the restrictions have been lifted considerably. I think it's important to understand that for many of our whānau, they still feel quite isolated. I know my mum won't go to the supermarket until it's early in the morning because she wants to get in before it gets too crowded. She's worried about catching COVID-19. And I know there's a lot of kaumātua that don't easily go out into shopping centres or travel outside of the area because they're worried about getting COVID-19. So understanding the importance of looking after our people, reaching out to them, whether it's a phone call, whether it's virtually, whatever it is, staying in contact with one another, staying in contact with the people you love, because actually COVID-19 does have an impact on your emotional and your mental well-being as well. You need to look at those sorts of things. Paura, you know, one of the challenges that we face, and it's probably not something that's easily answered really, is, you know, we've had to face some huge challenges around tangihanga through this process. We are seeing a lot of restrictions being lifted, but you know, we're having people going back to the marae, that sort of thing, events being held. How do we uphold our tikanga through all of this, and at the same time uphold the requirements that we need to keep ourselves safe level? What's your thoughts on that? Because I know that's one of the challenges that we had to face through all of this.
That is a very difficult question to answer, Dita, because we know the importance of tangihana to iwi Māori, and the fact that, you know, with tangihana, we don't have just, you know, one group of people staying at the tangi the whole time. It's we often have different groups wishing to come through and pay their respects. So I believe that, you know, the virtual world has helped us with that greatly. People were able to, during the lockdowns, people were able to pay their respects via Zoom. And I think, although it's not ideal, it was a tool we had, and we still use it. We're using it now, you know. And I guess tikanga, it's important to understand that we can adapt our tikanga, and Māori are very adaptable. And that's just what we have to do. We have to do what we need to do to get by. And as long as the mana of the whānau and the person that has passed is upheld, I believe that's the priority. And I guess even now we are hesitant to hongi, and we're hesitant to, you know, to perform hareru at hui. We still have those people that are still, regardless, they come in for a hongi straight away. And if you know the people intimately, you can hongi. It's part of us. It's the protocols and the tikanga that we practice is who we are and what we are as Māori. And it is very difficult for our whānau to, I guess, not be able to attend a tangi in person. We know that, you know, we do things kānohi ki te kānohi, but I guess we just have to understand that sometimes we have to bend our rules a little bit in order to keep our whānau safe. And that's just the way it is.
Kia ora. And I just want to acknowledge your whāroa around all of that, because yes, tikanga is flexible. Tikanga can shift, and tikanga is used to keep ourselves safe. And so it is possible to uphold tikanga, but at the same time, make sure that we're safe from a COVID-19 point of view. You know, just Mickey, to you for your kōrero around that. Because of course, it's not just about tangihanga, it's about hui, it's about this, it's about that. But we need to, yes, adhere to tikanga, but understand that there's flexibility around that. And the key thing around tikanga is it's about keeping people safe. Hapai. I think we've actually come to the end of our webinar, whānau. So I just wonder if I could just hand it over to you, Paura, to close us down for today's hui.
Ai rā, te mea tuatahi tēnei rā ta mihi ki a koutou, kia tai mai ki te kōrero ngā mea o te COVID. Koutou ngā rangatira, oku rangatira. mō koutou mātauranga, mō koutou tautoko ki te whakamana te tikanga o ngā tūpana me ki te whakapiki te hauoro o ngā iwi katoa te tauihu. Nā reira, nei rā taku mihi aroha ki a koutou. Ānei tēnei karakia, hei whakakapi tēnei hui mō tātou. Mai e, te tupua, mai e, te tāwhito, mai e, te kāhui o ngā riki e. Mai e, te tāwhiwhi atu ki ārongo, e rongo, e whakarongo mai. Tau mai tō Māori kia hahau ai te rongo, haumi e, hui e, tāiki e. Kia ora tātou.
Kia ora e ho. Mātawa whānau.
Ai.
All the best.
Hei kona.
Mari wā.